Let me talk about a couple things really quickly, and my fellow panelists have touched on it. Before joining the DoD, I was a CIO at the Federal Aviation Administration,
right.
and when you talk about aviation and what's been happening there, the airlines for a number of years have been using telemetry to monitor the status of their aircraft, as have the engine manufacturers. And when I look at things like, and I just made some notes here, Fitbit, Progressive Insurance has got a gizmo that'll, you stick in your car and it'll tell you how you drive. The new Apple Watch, I think, is going to take your pulse and is already connected to the internet, and sort of all the emphasis on preventive medicine and getting away from responding to an incident to a more proactive way of caring for the patient. I think we're not very far from a situation where you're going to wear a device that'll be communicating back to some provider that you designate that will be regularly sending your information back there. I don't think we're very far from that at all. And I guess the other thing that I would mention is, all of our systems are hospital centric or provider-centric, and I think we've got to move to a situation where our systems are really much more around the individual. As Dr. McCoy alluded to, some genomics and where the repository of the information really resides with the individual. And when I show up to my provider with a database of my information, and he uses that to treat me, and then if I go to a different provider, then he gets to use that information as well. So that's kind of where I think we're going, much more patient focused rather than incident focused or provider focused.
Yeah,